We heard you brief the minister a short while ago, and interestingly, as you turn this way, here's a little cage where some of your people that have been in quarantine for the past couple of days, yes. Some of them are looking forward to going home.
Yes. Some of them aren't. Some of them are telling me how much they enjoy it, actually. And they're sitting out in the sun. I wouldn't call it a small cage. People who are well jogging around the perimeter. So my message is actually that people are quite enjoying being in Nasrec to some degree. Clearly, they want to go home and see their families. But this is a recreation area, and they're actually quite happy.
Doc, let's turn this way, and maybe have you in this background. We spoke to one or two of the guys, and they said, it's been fun. They are being well taken care of, and there's always the propensity for people who are at home saying, do I need to go to a government facility, maybe I should go private. People here are being taken care of.
Are very much being taken care of. The food is nice. It's warm. The food's nice. It's warm. People are out in the sun in what would otherwise be a recreation area, and they're keeping their families safe by being here. So, if people have got COVID and they live in a crowded area, which many South Africans do, we know, and they're worried about transmitting it to their family, then there is space available at the Nasrec facility, and people will find food, they'll find Wi-Fi, they'll find Netflix, they'll find friendly people. We may all be hidden behind a mask. I'm sorry about that, but I can think of worse places to spend a couple of weeks to protect my family.
Doc, I know you're on the way to shift.
I'm going to shift now.
And thank you very much for your job.
Pleasure.
Frontline, a lot of you doctors are doing a world of good for South Africans out there. Last minute warning, if I can call it that, message to somebody sitting at home saying, I won't necessarily wear a mask, I won't get it. It is real.
It's real. Look, you've seen everyone wearing a mask. You won't see me without a mask. I wear a mask in front of my children when I go home, just in case. So wash your hands, stay at home, wear a mask, please.
Thank you very much.
Thanks. Bye.
Well, there you have it. One of the doctors who was in charge of the center here at Nasrec. In fact, this particular doctor also does a bit of, I'm not going to call it moonlighting, but also works at the Borough Hospital, the biggest hospital in the Southern Hemisphere, not too far from this center. And as you heard the doctor say, although situations such as these patients seem to be caged in, but you heard from one or two of the patients, they are doing just fine, in fact, and as far as they're concerned, they are looking forward to going home. Now, interestingly, when we got to Nasrec, we just happened to speak to one of the patients in front of the gate, in front of the railings here, and we were reprimanded by the staff here. Green, yellow, red is the robot. Everyone knows what green, yellow, red is, as far as driving is concerned. Green, you're safe. Yellow, you're getting too close. Red, you shouldn't be there. And that's where we started off. Luckily, we were told just in time to move back from the fence to be able to speak to some of the patients who are in here. Some of them are outgoing patients, as you heard the doctor say. Some of them will still remain here. But for those who are going home, they're definitely looking forward to it, having been cured of COVID-19 for now.